a woman who had breast cancer. The woman who had breast cancer had very high levels of the specific oral bacteria called Fusobacterium nucleatum in their breast. So this is, I would say, some of the newest emerging research that's coming out. So with breast cancer, I didn't know this before this research came out, but your breast has its own microbiome. So that tissue within the breast, different bacteria are able to grow. And what they found was that in women who had breast cancer, they had high levels of certain oral bacteria in their breast microbiome. So the oral bacteria is called Fusobacterium nucleatum. And they compared the breast microbiomes of patients who didn't have breast cancer versus those who had breast cancer.
Sorry, what's a breast microbiome?
Just the collection of bacteria in your breast.
Okay.
Yeah. I didn't even know there was a microbiome in your breast either, but apparently so. Okay. And so when they compared a healthy woman, her breasts, to a woman who had breast cancer, the woman who had breast cancer had very high levels of the specific oral bacteria called Fusobacterium nucleatum in their breast. There's also been research on colorectal cancer. And actually, Apple News came out with something a couple of months ago, which was nice to see them kind of just spreading the word. But what they found was that in patients who had colorectal cancer, more than 50% of them had the exact same oral bacteria from the breast cancer study, that Fusobacterium nucleatum, in the colons. And what they found was that oral bacteria made the cancer more aggressive and harder to treat as well.
I was reading about a study in mice that linked that oral bacteria to tumor growth. Mm-hmm. Are you familiar with that study?
Yes, and it's that specific oral bacteria, so the Fusobacterium nucleatum, which has been shown to accelerate tumor growth within mice, but also for colorectal cancer and breast cancer as well.
And what's your belief there? I know this research is fairly new, but do you think there is a causal relationship, a significant causal relationship between the health of our oral microbiome and our probability of developing some form of cancer?
I wouldn't yet say causal. I think that for most cancers, it is multifactorial, and there are a lot of things that can impact whether or not you get the cancer and how aggressive the cancer is. I do think that oral health and some specific oral bacteria are risk factors and can definitely increase the aggression of those cancers or even the initiation of them. There's also been research, and I think I'm waiting for the research to be published, on what they're doing is they've created an antibiotic which only kills that oral bacteria that I was talking about, so Fusobacterium nucleatum. And they are going to be issuing that antibiotic to those patients who have the colorectal cancer, which has the oral bacteria, to see whether or not it slows down their progression or improves their prognosis. So if I see those results and it shows it, then there's for sure a strong causative link between the two. But for now, I would say that it's multifactorial and it's definitely a risk factor.
That oral bacteria that you're describing, that you called it Fusobacterium?
Yeah.
What is it that causes that? Is it something that I'm eating? Is it a lifestyle choice I'm making?
Multiple things. Poor oral hygiene. Some of us genetically will have higher levels of it. It's what we eat. It's who we're kissing. It's what we're breathing in.